Hi, my name is Khalid Sharif. I'm a consultant orthopedic surgeon with an interest in sports surgery, and today is the exciting third series of hip pain in athletes. Um, I'm going to be speaking about what is a sports hernia, how does it present, how do we diagnose it, how do we treat it, and how do we prevent it. So, uh, if you like the video, please do give it a thumbs up, share it, and subscribe to the channel. And thank you very much for all the comments I'm receiving across social media about the channel. It's growing very nicely and I really appreciate it. But do subscribe to the channel so that I can make more videos and so that you can have access to them. So let's dive in. So what's a sports hernia? Sports hernia is not actually a true hernia. Why? Because there is no bulging of an organ through an orifice or through a weak spot in the abdomen. So let's get this clear. There is no bulge in a sports hernia. Why? What happens in a sports hernia then? Basically the oblique muscles at the bottom of the abdomen gets weak or strained or tear. There's a tear, or it may affect the tendons that attach to the pubic bone, and you get pain in the groin. How does it present? It presents with the pain in the groin, and initially very sharp, but later on it becomes chronic. It can radiate to the inner thigh. It can radiate to the pubic symphysis, and can be very confusing to diagnose. And the signs, very often you find no signs. You'd be lucky to find some tenderness at the lower abdomen or at the pubic symphysis or some of the tendons that attach to the pubic bone. But you can use some tests. I use a test, a very useful test, is I get the athlete to stand on one leg and to twist, and that exacerbates the pain. Or to get them to do some resisted sit-ups, and it will exacerbate the pain in the area. That suggests it. The pain can also increase with coughing or sneezing, but crucially there is no bulge. I also get an MRI scan, and the MRI scan will rule out other causes for groin pain, but sometimes it shows nothing. And if you are lucky and you've got a good radiologist that reads it, you can see some weakness in the or thinning in the abdominal muscles. It may lighten up on T2 weighted images. There's collection of fluid maybe locally. And then another diagnostic test is you can inject some local anesthetic in the area of pain. If that takes away the pain, then that is also suggestive of a sports hernia. So how do you treat a sports hernia? The treatment is actually mainly conservative. You have to rest it initially, avoid the activities that cause it until it settles down, and then you have to engage in exercises. Mainly they are core stability exercises like planks, side planks, dead bugs, pelvic stability exercises like bridges, clamshells, adductor exercises like putting a pillow between your knees and squeezing, or using a machine at the gym to do that, or sometimes standing adduction exercises. But it's important that it's actually done under the supervision of a physiotherapist, especially initially. The surgical treatment for this, although it's very rare, but sometimes we have to resort to it, and this mainly involves repair of the transversalis fascia, or sometimes we have to undergo a repair of the genitofemoral nerve. So I hope this is useful. I will, as promised, prepare another video, which I'm going to call it part 4, just to speak about the other diagnosis which can sometimes confuse hip pain in athletes, which is trochanteric bursitis. I hope this is helpful. Thank you.